You're very welcome. It's Sunday the 27th of December. Bit hard to read what's going on with the pandemic at the moment. Let me just show you what I mean, because we've got these delays that you would expect in reporting over Christmas. So the United States, Germany and Canada, these aren't real downturns, unfortunately. It just reflects reporting delay in cases. New cases adjusted per capita. The UK is slightly more up to date in its reporting. But that gives us an idea of where we are. And the Netherlands and the United States, the Netherlands is actually the country in Europe with the most number of cases at the moment, the highest number of new cases. And we see that that's roughly on a par with the United States at the moment. So that's kind of where we are at there. Now I want to start off with some really good news. This comes from Pascal Soriot, and he is the managing director or CEO or something like that of AstraZeneca, who are collaborating on the Oxford vaccine, of course. And it looks like the trials will show efficacy equal to the Pfizer-BioNTech and Moderna vaccines at 95%. Efficacy for the Oxford vaccine. What he says is we've figured out the winning formula. So this is really remarkably encouraging. You might remember there was this thing with the Oxford vaccine where they gave 2 large doses of 50 billion viral particles and they got about 62% efficacy. But then they gave some people only 22 billion viral particles followed by 50 billion viral particles, slightly less than half of the dose. And it turned out they had 90% efficacy. So let me give you an exact quote of what Pascal has said, so we're not misrepresenting him. We think we figured out the winning formula and how to get efficacy that after 2 doses is up there with everyone else. And what he means is up there with the Pfizer-BioNTech at 95% and the Moderna at 94.5%. So this is encouraging. Now he said this in a news report today on Sunday. It looks like pretty well for sure the Oxford AstraZeneca vaccine is going to be approved tomorrow on Monday. Remarkably good news, and this is just going to change everything. And with these high efficacy figures, combined with the low cost, combined with the fact that you can transport it at fridge temperatures, it is really going to change the situation dramatically. But it will take quite a bit of time. So anyway, today I'm going to get onto the content, a bit about the United States, looking at California, which is really suffering a lot at the moment, some figures from the UK. I also want to remind ourselves of the risk of this infection in children, and then we'll see how we go for time after that. Risks to children are small, but they are there, and we need to be aware of it and recognise it if this multisystem inflammatory syndrome in children rears its ugly head. Let's start off though with the United States. Now the flying figures for over Christmas in the United States are 8 million people have taken flights, so pretty high infection will have spread in that. And I just want to combine that with another piece of information. In American US COVID units, as indeed anywhere in the world, there's no family visitors allowed. And what this means is the people that are dying of COVID-19 are dying alone without their family members. And this, of course, is a complete tragedy. Dying alone it's a terrible thing. Now, dying at home, of course, surrounded by family is the ideal. The second best is dying in hospital surrounded by family. But to die in hospital with no family is the worst of all situations. So I just think, I don't mean to be melodramatic, but I just want to put that in. It just shows how serious this issue is, and the human stakes that are involved here are really significant. Now, California seems to be heading up the bad news in the United States at the moment, unfortunately. So let's have a look at California. Now, this is from the California government site, so check that out for yourself. All the data is readily available. The individual data for all the states in the United States is very good. You can click on your own state government website and you get really good quality data there. So that's the California one. Now, 7-day positivity rate is 11.3%. And as we know, this is a very high positivity rate. It means 11.3 out of all the tests being taken are coming back positive, indicating there's a lot of community transmission going on. as case numbers continue to rise in California, the total number of individuals who will have serious outcomes will also increase. As we know, that is a direct quote again from the Californian government site. Total deaths in California, statewide ICU availability of beds is 0. Every ITU bed in California is full. Now, this is not good because Gavin Newsom, the governor, hospital numbers will double in the next 30 days. So what is going to happen is by no means clear. By no means clear. The real risk here is that people will be dying who otherwise could have been treated. If they've been treated in the short term, they'd live in the long term, but some of these people may not. So quite what the state response is going to be, the federal response is going to be. But Governor Newsom's figures is showing that the number of hospitalizations is going to double in the next month. This is a massive problem. There's no point trying to understate this at all. LA County, for example, hospitalizations tripled in the past month. There's a COVID death every 10 minutes in Los Angeles County. And testing has begun for the 2012 NY501 strain in Los Angeles County. So is this strain already there, this new mutant strain that we're worried about? We don't know because of the limited testing. I'm going to be talking more about the limited testing as well. Now, California website also shows, another official government website, the differential way that this infection is impacting on different ethnicities and communities. So case rate for Pacific Islanders, that's the number of people getting infected, is 20% higher than statewide average. Latino deaths are 23% higher than statewide average. Black African American deaths 20% higher than the state average. And the case rate in income areas less than $40,000. There's many areas in the UK with less than that income as well, but that they have 7% higher rates. Now, we notice that the Latino death rate is 23% higher and the Black African death rate is 20% higher. Now, this is not as bad. This is appalling, of course. Of course, it's appalling, but it's not as bad as other areas which have shown much higher rates of increased death in Latino and Black African American groups. So it's not as bad as other areas, but it's still pretty bad. And remember, each one of these deaths is a individual family member, an individual person. Now, the California website comments in detail on this multisystem inflammatory system in children. Multisystem inflammatory syndrome. So multisystem means it affects potentially many systems of the body. So the cardiovascular system, the respiratory system, the gastrointestinal system can all be affected. And it occurs in children. So multisystem inflammatory syndrome in children. Syndrome, as we know, means a wide possible variety of presenting clinical features. Now, as of the 21st of December, there was 157 cases of multisystem inflammatory syndrome reported in children statewide in California, but counties with 11 or less cases. So this is a report from counties with 11 cases or more, because what's happening is counties with 11 cases or less don't publish the data because with that small numbers it could well be possible to identify individuals. So for reason of confidentiality it's not published. So it looks like the number of cases is quite a bit higher than this in fact, and it's 157 that have been published. So the frequency of this seems to be a bit higher than we had thought, and I forget how many. So it doesn't say how many counties didn't report, but from memory there's there's about 58 counties I think in California. I did check this morning. So it looks like some counties aren't reporting because there's less deaths, which is good, but it means we don't get a total picture of what's going on. So again, this is a concern. It's a concern that some children are being badly affected by this. Very uncommon in children, of course, but yet it's happening. So do remember it's rare, but it's an inflammatory condition and it's associated with COVID-19. Now, it's hard to say that it's caused by COVID-19, although it pretty well certainly is. But it's associated with it, but the links aren't entirely clear. But we know that this can develop after an episode of infection, whether that infection is asymptomatic or not. Can damage multiple organ systems. This is the problem. You get long-term damage to organs in this condition. So it requires hospitalization and it can be life-threatening. And it's very important to know about this. And this is the case whether you live in California or wherever you live. It doesn't make any difference. We have to have a high index of suspicion for this in children. So anytime there's COVID-19 around and a child develops possible inflammatory syndrome, we have to have a high index of suspicion for that and report it to doctors and paediatricians immediately, because it can be a time-critical interventions can be required. So how would we recognise this? And again, this is the same wherever you live, just happens to be from the California site. So Californian government advice: fever that doesn't go away, so fever over a long period of time, abdominal pains, vomiting, diarrhea, which is loose stools, runny stools, neck pain, rash, bloodshot eyes, excessive tiredness. So these can be actually recognised as inflammatory things. So fever is actually an inflammatory mechanism, is one way to look at it. Inflammation in these various parts of the body can cause these features. So gastrointestinal tract, vomiting, diarrhea. Neck pain could well be from the surroundings of the brain, the meninges. The rash, the bloodshot eyes, I will probably add an inflamed tongue to this as well. Feeling tired. Getting direct advice from the Californian government website. Contact your child's doctor immediately if your child has these symptoms. Early diagnosis and treatment of patients is critical in preventing long-term complications. So it's just, we need to maintain a high index of suspicion for this in children, although it's common because early reporting to doctors, healthcare providers can have long-term benefit. Now, moving on to the new variant now. What is happening with this new variant, this new transmissible variant, first identified in England, that we've been worried about for a week or so now? Denmark, these are the number of cases. Denmark, 33 cases, not linked directly to the UK. Found in various places, indicating there's community spread in Denmark, where they're doing a lot of testing. Germany, one from the UK, Singapore, one from the UK, France, one from the UK, others being investigated. Japan, 5, all from the UK. So Denmark, we see this community transmission, but in these other countries where there's less testing, that hasn't yet been identified. So is it that it's not there, or is it not being tested for? We don't know. Spain, Austria, Lebanon, Sweden, Netherlands, Italy all have confirmed cases. And Canada now does as well, in Ontario, a couple from Durham region. We don't know much about them. We do know it's one couple. They've been tested by genomic testing. They have this 2012 mutation, and they've no known travel history or high-risk contacts. In other words, they have not been to the UK, and they haven't been in contact with anyone who's been to the UK, indicating there is community transmission of this in Canada. Is there community transmission of this in the United States is another obvious question. Well, the testing in the United States is much lower than one would expect for the United States in terms of genomic testing. So it is by no means clear. We've mentioned in Los Angeles County the testing for it. Other areas, much less information available. Limited genomic testing. Now, I'm not going to go through a lot of history at the moment, but it's been one of the themes of this pandemic has been major errors by very powerful players and lack of accountability for what they have done and not done. So just a quick whiz through that one, very quick. So January the 12th, China publishes the genome. January the 12th, Thailand diagnosed a sick traveller from Wuhan, just from looking at the genome somehow. January the 13th, 2020, World Health Organization publishes a test recipe. January the 13th, Thailand deploys a new test and starts diagnosing people. And I remember we talked about these in the early days of this pandemic on this channel. February the 26th, the CDC finally gets their act together and starts testing. A delay of 46 days. I mean, it is just incredible how long it took the CDC to get this test together. And in that time, of course, the virus was well and truly seeded in the United States and the pandemic well and truly began. And now genomic testing seems to be poor as well. So surprising, 46 days delay. So the Thais had a delay of 3 or 4 hours while they made the test. The CDC had a delay of 46 days. And on this channel, I remember in February, we were absolutely ranting, telling the CDC to adopt the World Health Organization protocols for this, just to save so much time, but it didn't happen. Then they finally put out a test 46 days later on the 26th of February. And no public apology that I'm aware of. The more senior people are, the less accountability there often is. 15-acre campus in Atlanta, 15-acre campus, Centers for Disease Control. Now, maintain officers and a staff of 170 epidemiologists, laboratory specialists in Thailand. The irony there, 170 staff in Thailand. And the budget in 2018, for which is available, 11.9 billion, but 46-day delay. I think the least that the American people are entitled to is an apology. Anyway, enough of that. Update on the vaccines. Now, let's just the news on the vaccines is good. Let me just see if I can find you some pictures. Now, some of you hopefully will remember when we talked to Kylie. Have I got the right pictures here? Let me see. I think we have, yeah. Yeah, there we are. Got it. Sorry. Right, so this is not Kylie. Carly. So I am dyslexic with names. This is entirely my fault. Carly. Right, Carly, of course. Right, so Carly was interviewed by us a few months back. A very interesting interview, still available. This is the room where she was vaccinated. This is Carly actually getting vaccinated. And then, very kindly, she's recorded us a message. So let's listen to that now. And I'm delighted to say, I wasn't going to show you this yesterday, but I wanted express permission from Carly to show it, and she has given that permission now.
I just got the Pfizer vaccine, and I'm feeling really emotional about it. I just got out to my car, and I'm so proud of my hospital for the way that they're rolling out this vaccine. Just doing a top-notch job in the building where I just got it. Super great effort by the institution and the nurses, the pharmacists, and others that are working together as a team to seamlessly and effectively roll out this vaccine. I think what I'm feeling as I walk away is just that I've been going to work every shift since March now, living in fear that I would either get the COVID-19 virus and bring it home to my family, or that I would somehow inadvertently harm a patient by exposing my patient. And I just am so relieved and grateful to have had this vaccine today. It's just a huge relief. And so I'll get the second dose in 3 weeks from now. And it's time to celebrate. So I'm going to go have a good day. And we're going to celebrate as a family, just with my husband and my 3 kids this year. We're not out of the woods yet, but like people are saying, this is a step in the right direction. I hope you guys all have a great Christmas Eve. Bye.
So, Carly, thank you so much for sending that in. And we share your relief and delight and emotion at that. It's and thank you for letting us share that. We appreciate that. Now, moving on to vaccination principles in general here. It's a race, infections versus injections, or injections versus infections. This is kind of where we're at. Now, at the moment, infections are way ahead. So let's just look at some UK data that shows that. We see increases in cases in the UK by specimen date, by date reported. Now, unfortunately, we see all those trends up in the UK. Now, the UK is actually also starting to report vaccination records with healthcare things now as well. So, unfortunately, the latest report was 2,143 patients admitted to hospital, and currently 21,000 patients in hospitals now. So this is quite a significant number, because this means we're back up to where we were at the spike of the first wave, as we'll see on this graphic here. So this is patients admitted to hospital, but this is patients actually in hospital. So we see the numbers have gone up really significantly, and are likely to carry on doing so for some time as well, because of the delay effect from the increased numbers of cases. Patients on mechanically ventilated beds, thankfully not as high as it was. But we do know that the total hospitalizations is going to increase, because the cases have increased because of the delay effect. Let's just go back and look at those cases. So these increasing cases are going to feed through into more hospitalizations. So at the moment, in the injections versus infections race, the infections are winning. But we've had that good news from Oxford AstraZeneca, remarkably good news from there, and the European Union countries have now started doing their injections, started doing the vaccine rollout. So I've put Grand European Kickoff today, Sunday the 27th of December. Now, if you detect a degree of cynicism in this, the way I've written this title, let me assure you that is entirely deliberate, because it's just been characterised by so many delays. Without German and Spanish pressure, the European Medicines Agency wasn't even going to be reviewing this until the 29th of December. They finally reviewed it on the 21st, whereas in the UK we've been giving out vaccines for some time now. So it started. It's a good thing that it started. So population, 446 million people need vaccinated. 27 states only using the Pfizer-BioNTech vaccine at the moment. Now, this is a direct from Ursula von der Leyen's Twitter feed. She calls it a touching moment of unity amongst the European nations. But the truth of the matter is that to have this moment of unity where everyone started giving out the vaccine today, they've had to have delays. And this is a politicisation to me, which is just completely unacceptable. Anyway, after the delays of the European Medicines Agency as well. So anyway, Slovakia, Hungary and Germany jumped the gun, probably deliberately so, to make a bit of a statement that they weren't very happy. Other 25 countries are starting today. They've all been given some vaccines, some Pfizer-BioNTech vaccines. So already vaccinating UK, Serbia, Switzerland, Bahrain, Israel, Canada, United States, of course. So it's good that they've started, and it's good that they're sharing the vaccines out. It's bad that they had individual delays. You see, Germany, for example, have been straining at the leash for weeks on this. They make some of the Pfizer vaccine in Germany. They can import others from Belgium. They had the personnel, they had the infrastructure, they had everything ready to go. They were just waiting for this European Medicines Agency. Had they been allowed to make a decision on a national level, they would have been vaccinating, I would imagine, about the same time as the UK. It's been a very big delay, and for political and administrative reasons, in my view. Right, so Germany, population 83 million, they've just received 160,000 doses. So we can see that this grand European rollout is just the very, very, very beginning. Very beginning. By the end of January, they're hoping for 700,000 doses per week. This is good news. The Pfizer vials. So they put this vaccine in the vials, and what they started noticing was you're supposed to get 5 doses for 5 vaccinations per vial, but it seems some vials have up to enough for 6 or 7. And the FDA in the States have said this can be used, so that could potentially increase the rollout by 40%. So that's good news. So generous of Pfizer to put a bit of extra vaccine in the vial there, which they at least are allowed to use in the United States. And I would imagine the same permissions will be granted in the European sector as well. So that's just minor good news there. AstraZeneca is working with the Russians on vaccine development at the moment. Now, don't know anything about that, but it's interesting. Now, getting on to the Oxford vaccine, which we've just learnt from press release today, unless the managing director of AstraZeneca's got it wrong, which I think is rather unlikely, we're going to be getting very good efficacy figures on the Oxford vaccine, which is a world-changing one. Remember, the Oxford vaccine, room temperature, dirt cheap, rolled out at no profit. They've agreed not to make a profit for the course of the pandemic. Medicines and Healthcare Regulatory Agency, will be approving this, I think, tomorrow. So this will be approved on Monday or probably Tuesday. Don't know which. I think it's probably going to be tomorrow. Unless we've completely misread the situation. In which case I'll be apologising on Tuesday, but I don't think so. Mass rollout, we believe, is going to start on the 4th of January. Mass, absolutely mass. 1 million people per week. So that's good. Now, I've had an email, that's all we're doing today, but I've just had an email from Chris. And Chris lives in Liverpool, where you might remember they had this mass lateral flow test thing. So he's talking about the huge amounts of money the government are planning on spending on this moonshot to test everyone. And I've been very critical of this all the way through. I mean, I'm not saying testing is not brilliant, it is. But anyway, let me read you what Chris has said, his concern, which I share. Here in Liverpool, the negative test result it gives people are being taken as a licence to mix closely with others, including particularly vulnerable people. So we know this test can often give false results. It can give false positives and false negatives. So here we've got people who probably actually have the viral infection. They have the test, they're being told they haven't got it, and then they're going out living their lives as if they haven't got it. Apart from anything else, they could be infected 10 minutes after they've taken the test. Apart from anything else, but it's also giving false negatives. I even heard the former mayor of Liverpool tell BBC radio listeners that these results make it safe to visit elderly relatives. Now, I haven't listened to that interview from the former mayor of Liverpool, who's had to resign for other reasons. But it doesn't matter. It's Chris's impression of what he said. And I'm sure Chris has got it right anyway. People think that this negative test gives you permission to mix. And this is the problem. This is where we need the education. But I'm sceptical of this mass test programme anyway. Chris says, surely this scheme is boosting infection rates rather than reducing them. So a concern I share, Chris, and vaccination is the way out, not rather than this mass testing regime, I believe. Right, a few pictures then we're finished. Well done if you're still here. A bit of a long video. Now, this is... I've forgotten who sent this in. My apologies. But anyway, it's a bank in Florida Beach, and it's got this ventilation system. I'll tell you who it was tomorrow. I know, I just can't remember. So good to see ventilation systems here in public buildings. So that's brilliant because we know how great importance ventilation has in preventing the infection. And this is Esme, the daughter of Thomas and Lucy, who watches the show. So show, program, whatever it is. Yeah. So great to know we've got listeners of all ages as Esme takes an interest. So thank you for watching as always.